Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. We will unmute your microphone when you're called upon, and then you will have to unmute your own microphone.
Good afternoon. Thank you for joining us again this afternoon. We've got a report coming up here from Dr. Box on the latest numbers on the ground, but we'll also be joined, very timely, impeccable timing, I must say, from Senator Braun down in Jasper, Indiana. But before we get to the senator and the bill that was just signed into law by the president earlier today, Dr. Box, could you give us an update?
Absolutely. Thank you, Governor. Good afternoon, Hoosiers. Today we reported 656 new cases of COVID-19 and unfortunately an additional 35 deaths here in Indiana. These numbers bring to 13,680 the number of Hoosiers known to have COVID-19. A total of 741 Hoosiers have died to date, which is about 1% of all the individuals who have been tested in our state and about 5.4% of our confirmed positive cases. Today's totals include 3,533 new tests. To date, more than 75,000 Hoosiers have been tested for COVID-19. Later today, we expect to add to our dashboard an additional 79 presumptive COVID-19 deaths that have been clinically diagnosed. What this means is that a physician listed COVID-19 as a contributing cause of death for a patient, but no COVID-19 positive test was documented on that individual. The clinical diagnosis of COVID-19 can be made using a patient's X-ray, the CT scan or CAT scan of that individual's chest, and the full clinical picture, including their medical history, their clinical symptoms, and how their course of illness proceeds. This may include ruling out other bacterial or virus infections, such as influenza, as the cause of their illness. COVID-19 can also cause a very characteristic picture on a CAT scan of the chest that, when combined with the clinical features, can be used to make a clinical diagnosis. These clinically diagnosed presumptive deaths will be reflected in a separate area of the dashboard and will not be included in the total number of confirmed cases that you're accustomed to seeing. Adding these deaths gives us a better sense of the impact of COVID-19 and positions us to also capture more of these clinical diagnoses going forward. We continue to urge physicians to test symptomatic patients if they have the resources to do so, but also recognize that people who may not be tested are also likely to have COVID-19. I also want to provide some updated hospitalization and discharge data, which you should be able to see on our website. Our partners at Regan Streif, Indiana Health Information Exchange, and FSSA have all now looked at 9,402 cases who have been hospitalized for COVID-19. Of those, 33% have gone to emergency departments, which is down from 35% the last time that we presented this data. 27% have been hospitalized. While the number of people hospitalized increased, the rate has stayed steady with what we saw on April 17th. Of those hospitalized, 339 went to the intensive care unit at some time during their stay, for a total of about 25%. And of those who were admitted with positive COVID-19 tests, 6% went to the ICU. That's all the positive COVID tests. What's really encouraging is that we've seen the number of people with COVID-19 who have been discharged grow from 68 to 80%. Of the remaining 20%, 14% unfortunately were known to have died. I would also like to provide a quick update on the state's efforts to obtain PPE for our hospital personnel, first responders, and our long-term care facilities. These numbers reflect the progress that we have made working with Indiana businesses and manufacturers to order these critical supplies. As we have said many times, the first priority for these supplies, once they arrive, is emergency use only for frontline responders who are facing shortages. Indiana can never have enough personal protective equipment, and we will continue to work to secure supplies. It's also important to note that while we have ordered these supplies and are so grateful for what has been donated or pledged, we have only received a fraction to date of these supplies. Finally, I want to provide some clarification about the study that we announced yesterday. We've had a number of people reach out and volunteer for this study, which we appreciate. But the participants, as we mentioned, were randomly selected, making sure that this is a scientific study that accurately reflects the demographics of our state. So we're not seeking volunteers at this time. ISDH, however, is working on a plan for further public testing and will be sharing those details in the very near future. Thank you very much.
Thank you, Dr. Box. And now we'll go down to Jasper, Indiana. Senator Mike Braun is with us, and I just literally jumped off a phone call with other governors, my gubernatorial cohorts around the country, and the vice president and his whole coronavirus task force. We talked about the president just signing live, or earlier this morning, signing that 3.5 PPP law into effect, and that's extremely important to every Hoosier, every American. It's going to devote more money toward our small businesses, and that's something that's been near and dear in Mike Braun's DNA. Also, $75 billion to our hospitals. $25 billion to help with resources for more testing in states. But that, Senator Braun, if you could or would speak to not just that bill and that over $300 billion going towards small business help, but also what's next?
Well, Governor, good to be on, and been watching from afar down here in southern Indiana. Been back since March 26th, and actually in my wife's store in downtown. Was one of the businesses that had to shut down as non-essential, but they were appreciative here a couple of weeks ago to where they were able to do some curbside and so forth. So a lot of interest in, I think, an area like this and across the state. But I want to compliment what you've done because we will not get back to a normal in the short run, but there'll be a new normal, and it's got to be based upon keeping everybody safe and adhering to the guidelines. I'm proud of the Du Bois Countyans, where we've been lucky with, I think, 17 cases, and we got roughly 43,000 people. So what we do at the federal government level, we kind of caused the whole issue with the economy with the warranted effort to tamp down the disease. And I've been talking to so many business owners across the state, employees as well, that have been dislocated. But the 3.5 that we did here recently tells you, due to the need of how broad and deep that impact is. And of course, the question immediately has arisen as to, well, what's the next step? Leader McConnell's made it clear that until we get back, which is now earmarked for May 4th, based upon when things will peak out there, we probably won't do anything else, but we'll be gathering information. The agriculture sector is increasingly becoming a place that I think we'll need to turn some attention to. Major part of our economy here in Indiana as well. And then the other thing is many of the larger small businesses, I think, got in there with the first helping on that $349 billion. The guidance and the rules are really earmarked to help the smallest of the small. And when you look at what we put together, along with the $25 billion for testing, additional $75 billion for hospitals, I think we've rounded it out about as good as we can until we get back. Because here's an example. The trucking industry, which one of my companies, dedicated trucking company for the distribution business, 3 of my 4 kids now run that with a good young executive team. They were actually busier coming out of the gate with the forward momentum of what was a really good economy. Now, over the last 3 to 4 weeks, volume's been falling off about 5% a week. So we are getting so many sectors that are going to come to the forefront that are not really being heard up to this point, along with the ones disproportionately hurt. So I think whether we do more, we'll be haggling about that once we get back and talking about it in the meantime. I think that I know what you're concerned with is what do we do here to kind of pivot to this new normal that we got to get used to, where we can smartly kind of restart the economy, give no ground back to the disease, because we've done so well here in the state. Until we get a vaccine, until we get therapies that are working, until we get general immunity along with the vaccines that, cover about 65% of our state and our national population, we're going to have to make sure that we're careful with whatever that next step is. But with the federal government, we're running into issues of $3 trillion that we've just recently added to our national debt of about $23 trillion. And then we've got, unlike Indiana and unlike the job we do, where we believe in a rainy day fund and a balanced budget and all that, we don't do that at the federal level. So that's why the next step from the feds is going to be, I think, metered out pretty carefully.
Thank you, Senator Braun. It's not an overstatement to say that we could not be doing this without you. And I just appreciate the constant collaboration and communication between you and I and our offices, and look forward to working with you on that next step come May 4 or whenever it is that you're able to safely return to the chamber. And as I understand it, Senator Braun's going to be able to stay with us, so he'll be able to answer some questions when we get to that point. I just wanted to say before we get to that point, a word of thank you. I always try to pass out and around the praise. We have a lot of folks to thank, in addition to our Senate colleagues and our congressional delegation and all the local leaders that we have join us as well, trying to always underscore how this is a team effort and we're all in this together, whether it's the philanthropic community or the private sector or the public sector. But I wanted to kind of squarely focus today on thanking you. The steps that you have been taking and the sacrifices that you have made over these last long 5 plus, yeah, feels like years, yeah. They're making a difference. And if we hadn't taken these steps, Senator Braun just alluded to this, just stated it, had we not taken these steps, we wouldn't be in the position that we're in now, to be able to contemplate, to be able to plan, to be able to resurface and reemerge. And by the way, some of our businesses have been open for quite some time, much different operations, but they've been complying. They've been playing by the new rules of the new normal. And that's so critically important for not just their business, but for the Hoosier psyche, to know that we're going into safe places, whether you're a customer or an employee or an employer. And I want to continue to shout out our thanks for everyone that has contributed substantively by passing on their plans on here's how we will operate so that we can, what is in our control, we will control. And we know that we're put in this position, as I mentioned, coming up to May 1st, really coming up to next Monday, when we are going to be in a position for certain additional elective medical procedures to lift those restrictions. if those businesses include the measures required to operate in this new normal environment. And so I don't want that to be lost, that we're only at this point, and we're still, in the second quarter here, but we're only to this point because of the actions that we've taken or the actions that we've not taken. And we're doing it together. We're able to, because of those efforts, we're able to make sure, because of you, again, that we have our supply chain is flowing. It's never going to be enough, as I'm reminded every day, and that's true because we see local hospitals and nursing homes and churches, et cetera, supplying each other with homemade masks, or students using 3D printers. I mean, the list just goes on and on and on. How you talk about value add, how many people are stepping up to fill the void or stand in that gap and contribute. Now, that's in addition to what Dr. Box just went through, all that PPE that as a state we're purchasing and receiving. And in addition to what the businesses, they themselves have been ordering for years in the past. But now we're all rushing toward those same sources. And so this is going to take continued organization and teamwork. But when we think about having the PPE, that we need to be able to care for those folks who are going into the hospitals. And of course, as Dr. Box just said, there are some positive trends out there that we're seeing, those hospitalizations. However, we don't want to take our foot off the gas in the wrong stretch. And so that's why we will be methodical about this, and that's why we need to make sure that your PPE, as I see it, my PPE is the nurses and the nurse aides and the pharmacists and the doctors. Those are the folks who, the radiology assistants, the first responders, the police, the firefighters, the EMS, all these folks, that's my PPE. And so they need their PPE so that we continue down this path of progress. And with that, I would like to give one more shout out to my grandma's apron. They have, I just want to thank, they have made some pretty clever cookies to brighten a Friday afternoon. And I just want to, this is in New Salem, Indiana, and they sent in just reinforcing that we're all in this together, and we sure thank my grandma's apron. And that goes to you, because I thank you.
This is going to contribute to what we fondly call the COVID-19 around here, Governor, unfortunately.
That's great. And I'm personally part of that. Yes.
Chris Darby, Wayne 15.
Sure. Good afternoon, Chris. Thanks for joining us.
Governor. Yeah, absolutely. So we've been hearing from a lot of people at factories like GM, BF Goodrich, places like this that are kind of worried about going back to work, being safe, places they can't be 6 feet apart from each other. So I just want to know, first off, kind of what their expectations should be from their employers going back to work. And then if there's going to be any state groups like IOSHA that will have restrictions that they'll be specifically looking at with this pandemic.
Well, PLA, I mean, different businesses are in receipt of whole different licenses. And so, of course, the state will have a role in making sure that these are safe places to work. But I can tell you that, we've got a binder full of information that different sectors, industries, businesses have sent us, and some have posted, whether it's elective medical procedures, surgeries, manufacturing, construction, transportation that Senator Braun mentioned, logistics, I mean, virtually, again, A to Z, and they have sent us their plans, and they literally, obviously, first and foremost, deal with clean spaces, hygienic advances that they're putting into place to make sure that a safe workplace equates to, in large part, a healthy workforce. And so this is not just a balance, but this is a necessity in this new normal that we find ourselves in. But we'll be looking at, for different businesses, what are these new requirements and standards. We'll post all those. We'll be very transparent about all those. That's what's going into our next week leading up to May 1, to make sure that that if you're a certain distance, you need a barrier, or you might want to add to any.
So putting those barriers up and making sure that individuals have a good policy so that they're not, punished for missing work when they're sick, that there should be reinforcement for staying home, that they have the ability to miss those days. Those are really key things when you go forward as an agency or organization.
Yeah. And I would just say, Chris, that, obviously these are different. One of the challenges is whether you're a school or you're state, local, federal government, or you're a daycare or nursing home, or Senator Braun, and please chime in, Senator Braun, if it's ag or churches or retail or malls, the list just goes on and on and on, and we want to make sure that the healthcare industry knows what's applicable to them. We want to make sure salons and restaurants and bars and, it just logistics understands that we're all playing by the same rules, and this is all dealing with how we get through this most efficiently. Senator Braun, you want to comment?
Because since I've been back, I've spoken to so many businesses, and especially some of the, larger, medium and larger size businesses. And that's where you've got the most risk. If you've got 500 employees plus and you have one instance, that pretty well is going to derail you for a time through, the quarantine you got to go through, and it just has this tremendous ripple effect. And the thing that's impressed me most is how they've really been paying attention to the rules. They do know that for this to be successful, when we pivot to a smart restart, that there's going to need to be discipline, that there's no relaxing. And I think the self-incentive to make sure that happens is there, because they know that if they would get sloppy, backslide, that it would impact them, their employees, their customers, and even the Main Street, the smaller businesses know too that it's going to be different. And the ones that have been essential, I've been impressed, wearing the masks, gloves, keeping that separation. I think the fact that we've been talking about it so much, everybody knows the 3 things you really need to do, and we've got the results so far to prove that it makes sense. When we do get to that point, when we start to roll into reopening, I think you're going to be happy to see that all places are aware of what to do, and it's going to take a lot of discipline, a lot of hard work to get through to where we get this behind us.
Yeah, and we'll move right on, Rachel, but just as a reminder, we see this all over the state of Indiana. Typically, you start to hear about cases in the dense areas, in the metropolitan areas, in the big cities, but we're reminded almost on a daily basis that this can jump quickly to a Scott County or a Carroll County or a Cass County, and so it really has an effect on us all. And so that discipline that the senator's talking about, critically important that we stay on this path to progress. We're on it right now. And like I said, I can see the light in the clearing, but we're still forging our way through the forest. Rachel.
Ed Feigenbaum, Indiana Legislative Insight.
Afternoon, Ed.
Ed, you have to unmute your own microphone.
Good afternoon. Good afternoon, Governor. Long-time listener, first-time caller. Qualitative question for you on the state level and for Senator Braun on the federal level. What kind of changes in public health-related policies or priorities do you think should appropriately be the subject of spirited but responsible debate in the primary and general election campaign?
Well, that should go to me since you're not on the ballot. Look, I'll just tell you this, Ed, and then we can turn it over to Senator Braun, who's not on the ballot either. But look, it's a little bit eerie, to be honest with you, to be on the ballot and not putting any focus on that. And I'm going to continue to operate that way for the foreseeable future and let the chips fall where they may. I've got a full-time job that's, we're all working overtime. That'll have to take care of itself. Having said that, I will be perfectly comfortable talking about every single step and decision that we make anywhere, any day. Senator?
No, I think that's right. I'm not on the ballot, but just as important to me because we're all interested in getting things turned around, not only in our state, but nationally. And there's not been anything like this. It's kind of gripped the public's attention. It's created a national anxiety. And I was listening to Bill Gates here earlier today about what he sees down the road. And he's been probably the one individual that's put more time and effort into trying to tamp down infectious diseases, work on vaccines across a variety of different diseases. And, he said as well, and didn't really lean in on the political side of it, but said until we, thoroughly understand this and get through it. And I think that we as politicians, we as government leaders are the portal for getting this done, that it should be fair discussion, and it shouldn't be done in a way that I think hotly politicizes it, because it's a common goal for all of us. We want to do what's going to have the best return on investment for all the efforts we put in 2 days. And I think it's valid to speak about it openly and transparently so we can arrive at best practices and try to keep some of the political angles out of it, because then I think, get a little bit, turns into an unproductive discourse. But, being on the ballot in a year like this puts special kind of seriousness to it. But I think any of us that represent and that are government leaders need to embrace transparency, be open with the discussion, because we're all in it together. And the more we get and glean the best from practices in one state versus the other, versus national guidelines, we're going to get through it quickly and more intact economically.
Yeah, well said. I think that typically this is a campaign season, and there's nothing typical about this season. And so this is a time where it's all about policy, not about politics. I will say I've been so impressed and grateful that going through this together, it's brought so many people together of all political stripes, or people who are non-political. And that's what's been so encouraging, and that's what's going to make it, quite frankly, easy to share what we're doing, talk about all those best practices, stealing good ideas from other states or other cities or towns or people. We're trying to include and make sure that everyone's opinion is obviously not just a factor, but a part of that ultimate decision. And to date, that's why, in large part, we've been able to make so much progress.
Sheila, WLKI.
Good afternoon, Sheila.
Sheila, you have to unmute your own microphone.
Hello, Governor.
Good afternoon.
Hey, thank you for your time today. My question involves youth. With most schools being closed for the remainder of the school year, do you have any advice, guidelines, parameters, or even stop orders concerning spring and summer youth programs such as baseball and softball, many of which that are community programs that serve school-age children?
Yeah, we'll continue to address that. That's one of those things that a little bit heartbreaking, but seasons or prom or graduation, all the things that we have to sacrifice because we find ourselves in this position. But we'll continue to work with our partners at the DOE and the SBOE at the Department of Education as we get closer to those decisions that need to be made in those typical large gatherings, whether it's sports or theater or after-school activities that brought a lot of people together. So no decision on that yet, but I understand the timeline that we're dealing with as we get into, May's right around the corner. And so that's more of a kind of mid-May decision time period.
Kayla Sullivan, Fox 59.
Hello, Kayla. How are you?
Doing well, thank you. Governor, this question is specifically for you. We've already heard from Dr. Box on this issue, but many, including State Ombudsman Lynn Clow and AARP in Indiana, support the concept of releasing the names of nursing homes' COVID-19 data, saying there's no HIPAA violation. Will you direct Dr. Box to publicly release the names of nursing homes and their COVID-19 related data? If not, why? What is the danger of making this information available to the public?
I will not. And the reason is because we respect that private business, that nursing home that is operating under our regulations. And that's where the relationship exists. And by the way, we have taken a few extra steps to make sure that if that's not, that we're going to intervene. And we are.
Kathy Tritter, Ferdinand News.
Thank you, Kathy, for the job that you are doing.
Kathy, you have to unmute.
I have to laugh at you because I felt bad after I did that the other day.
Don't. No, that's fantastic.
Okay, my question, I want to look a little bit to the future, and I'm not sure anybody in the state government is doing this. I don't know if like the career group or anything, but these kids that were seniors and maybe didn't get to go for college trips and everything to visit any place. Boy, if you're going to go in the medical field, there are definitely jobs. But has anybody sort of researching what other sectors?
Oh, yeah.
That seems to me that it might be kind of important to kids that are like me who couldn't have been in the medical field.
Yeah. That's part of the silver lining, I guess, is that we went into this all in such a good position. We had about, Fred's here, we had about 90,000 unfilled, high-wage, high-demand jobs that we had the people, we had the workforce development programs in place. The trick or the challenge or our task was to get those folks connected with the job skills so they could fill those jobs. Now, as Fred just updated us all, we've got about 350,000 Hoosiers out of work, so we're going to need to get them back to the job that they had, if that job is going to be there. And if not, we are looking at what the future looks like already. We've got a whole team, the Indiana Economic Development Corporation and our Commission of Higher Education and our office, the Department of Workforce Development, all are looking at these target areas, healthcare being just one, but the world will change and it will have a new demand, and then we will start to target our resources toward making those connections in the new world. Fred?
Right, and to add on to that, we do have a rapid recovery plan that we're putting into place that teams of people are working on right now with the governor's workforce cabinet, again with some of the partners like Strata Education, TPM. A variety of entities are coming together right now to make sure that we look at things like that, so when we come out of this, we can really hit the ground running.
Tom Davies, The Associated Press.
Hello, Tom. How are you?
Doing well, thank you, Governor. Do you think the federal actions are providing enough adequate support for hospitals around the state? And along with that, is the state considering any financial support for providers also in healthcare, working with those with disability and home healthcare providers?
Do you want to take that? You're in constant communication with all of our hospitals and
So I know that the hospitals have been requested to give the federal government information with regards to the financial stresses that they've been under, and I think that that is coming up very soon. In fact, this weekend, as I talk with Indiana Hospital Association and Brian Tabor and others. So I know that the federal government is engaging and understanding that there has been some significant issues there, not just from the COVID-19, but the shutdown of the surgeries and the elective surgeries, surgery center information. So we certainly have worked with our hospital systems to talk about if, as they expand things, we can be able to give supplies like ventilators and other things to be able to bring them to where they need to be to surge their bed. So we have been in very close contact with them regionally across the state and as a group.
Yeah, and I'd just add that, Tom, a couple things. One, and we probably should go back to Senator Braun, but because of Senator Braun and Senator Young and our congressional delegation, they are looking at what we need, and they are addressing those needs in a very, again, methodical fashion, be it the first act, the second act, the third act, now 3.5. And so this is not just papering over some temporary problem. This is getting right at the root of what caused this derailment and now getting us back on track and helping us get out of this. I will also say that on the phone, and I won't make their news for them, Tom, but you should stay tuned because I know here shortly the administration is going to make some more statements about some additional help that they will provide states in terms of or in terms of nursing homes, et cetera. So pay close attention to that. If they're not making that news right now, it will be forthcoming. Senator Braun, did you want to add anything about the federal help and how you're approaching our state needs?
So that was state governments in general. That discussion was hot and heavy on the 3.5, and that got a little complicated in the sense that I think that's what we'll focus on once we get back. I think I said earlier, Leader McConnell has made it kind of clear that anything we do beyond this will have to wait until we get there. We put a lot out there already. Whatever we do marginally has to really be targeted. There was more for hospitals, of course, in 3.5, and I don't think they had gone through all of the allotment in 3 yet as well. But state governments are like any other entity across the country, been impacted accordingly. Some, as I referred to earlier, were better prepared for it, even in a state like ours, where we rank in the very top tier of being sound financially. We'll have to replenish depleted funds, and thank goodness we operate the way we do. That's going to be a little difficult to sort out because it gets complicated in the sense that, well, how do we do that if in fact some of the needs in certain states arise from the way they run their state governments? And that gets very tricky, and that's why it'll take longer to flesh out. It might be tied to certain reforms that you have to make within a state if we're going to comprehensively look at doing something. Other than I know it's going to be a topic of conversation, I can't really say what might get done. That, along with a few other things, we'll focus on when we get back.
Michael, WBEZ.
Hello, Michael. Good afternoon.
Good afternoon, Governor, and good afternoon, Dr. Box. I have 2 questions. The first is for Dr. Box. There's reports suggesting that 92% of inmates at the Westville Correctional Center have tested positive for COVID-19. Was there a misstep there in trying to contain the virus, since now essentially the entire prison population now has it, and what's being done? And for Governor Holcomb, your counterpart in Illinois, Governor J.B. Pritzker, says he will extend his state's stay-at-home order through the end of May. How might that influence how you go about reopening areas of Northwest Indiana?
So I think Dr. Doss is at the podium, so we'll let her address the DOC question.
Thank you for the opportunity and the question. Kristen Doss, Chief Medical Officer for Indiana Department of Correction. I am so happy to clear this issue up. We do not have 92% of our offenders at Westville Correctional Facility who have tested positive. Currently, there's roughly 3,200 offenders in the facility, and only 130 are currently positive for COVID. We have quarantined a certain amount of offenders as well, approximately 1,500, just because they have been exposed to those other 130 offenders. But again, it's a question about prevalence within the facility, and it's something that I'm happy to clear up. If I can also, I just was expecting this yesterday, so I'm so thrilled to again clean it up. I have personally had conversations with doctors, EMS, county officials up in the Westville area. I just want to give a special shout out to Dr. Ducey, the LaPorte County Health Commissioner, who really has supported us in this effort of clearing up the miscommunication, getting the facts out, protecting our staff who are working the front lines in these prisons to make sure that they are safe in the community. Additionally, the LaPorte County Nursing Supervisor and Dr. Cora, who serves at Michigan City hospital and is also on the county commission. So if there's any partner who again wants to help us in this effort, because we are all in it together. But again, I am perfectly comfortable talking about what we've done, like the governor mentioned, and why we're doing it anywhere, anyway. And then lastly, while I have the opportunity, I have to give a shout out to all of our DOC staff. Over 6,000 staff show up every single day to protect you, me, and all of our communities. These are correctional officers, nurses, physicians that go in every single day, and we are committed to keeping them safe, and thank you for helping me clean this up.
Thank you, Dr. Doss. I would say that I'll continue to stay in touch, as will our staff, with Governor Pritzker in any decision that he makes that would have an effect on us. You mentioned he extended his till June 1st. We're not contemplating that here in the state of Indiana right now. We're focused on May 1st and all the changes that we need to make and put into place through May 1st. And we'll continue to look at that, that road ahead in those kind of 2-week, 10-day, 3-week increments, because that's, when you think about when someone is infected, it's about a 3-week process from
Get exposed.
yeah, when you get exposed until you are through the woods. But you know, as earlier this morning today, I talked with both the Ohio governor and the Kentucky governor, and we talked about where we are on terms of testing and how we're all seeking to expand our testing capabilities. We talked about elective procedures, and we talked about our retail businesses opening up and in different stages. And so whether it's Illinois, Michigan, Ohio, or Kentucky, and even beyond that, but those are the border states that I'm in constant contact with, or our staff, to talk about those workflow issues, travel issues, being across a river or across a border, and we'll continue to do that.
Adam Wren, Indianapolis Monthly.
Good afternoon, Adam.
Afternoon, Governor. Have there been any inquiries from Hoosiers calling the state asking about whether injecting or ingesting disinfectants can help cure COVID-19, as the president suggested yesterday, or that sunlight and disinfectant could play a role in fighting the virus? Dr. Box, do you agree with these comments? And Senator Brown and Governor Holcomb, is the president making Indiana's efforts to fight COVID harder with these types of comments specifically?
I certainly have had some individuals that have reached out and asked about the wisdom of doing this, and we have assured them that that is not something that we recommend, and we have very carefully gone over the things they can do to try to protect themselves.
Yeah, and I would say, before you go to Senator Braun, I would say that, as I understand it, he mentioned today that he was being sarcastic about that, and so we would, if anyone asks, we will give them sound medical counsel.
So, Governor, I think you hit it right on the head that sometimes when you're not clear with how you say things, and especially when you're at a high level where people watch, it's best probably not to venture into areas that you may not know a lot about. And here I would defer to what the health experts would say. And I think on his part, he's feeling that pressure across the entirety of the country, where there are so many places that are anxious to kind of pivot to the next act. And I think sometimes in the exuberance of doing so, probably as often as you're there, you're going to get some of that. But, I think wisely stick to what is tried and true, and what the healthcare experts tell you to do.
Yeah, I would just add, apply those disinfectants to surfaces. They work, not yourself.
Paula Hinton, WPTA.
Hello, Paula.
Hi, sir. I have a question for Dr. Box. We had a viewer that called in saying that he was currently looking for a nursing home for his mother. He wanted to place her in a place that was safe, and was wondering how can he make an informed decision if he doesn't know if COVID-19 is in that home?
So I'm going to let Dr. Dan address that.
Thanks so much for the question. I think that is an important question. The guidelines that we have and that we'll be coming out with on Monday clearly will state that it is the obligation of that long-term care facility to let both residents and the representatives know who are planning on coming to that facility. So if somebody was looking for a long-term care facility, they would have an obligation to let them know whether or not they had COVID in that facility or not.
Thank you. And just a reminder, I mean, this is the incredible challenge that they have that's been foisted upon them to turn and burn overnight in an area that you said on day one, this was your number one concern.
Yeah, my biggest nightmare.
Yeah.
And they have really stepped up to the plate in so many ways. And we have been there to partner with them every step of the way. And it's just a matter of reaching out to us. And we do want to continue to encourage and enforce the transparency from the nursing home to the residents and those individuals who represent those residents and anyone who would be considering coming to that facility.
Julia, Wish TV.
Good afternoon, Julia.
Good afternoon, Governor. I have two questions for you. One, understanding that you've been in communication with the other governors in the region, including Ohio and Kentucky. How much of your decision-making on reopening is going to be impacted by what's happening in those states? For example, could there be different levels of reopening in Indiana along those state borders? And two, the Indiana AG's office stated on Wednesday they are evaluating the merits of a lawsuit against China, potentially calling on the government to pay for the costs of the COVID-19 pandemic. Would you support or oppose a move like that?
First I've heard of that. I can huddle up with my legal team, but a state versus a country, a nation, just off the top of my head seems a bit astray. However, I'm not a doctor, I'm not an attorney, so I'll have to follow up with you on that. First I've heard of that. The first question you had was about border and how the borders opening up or business opening up on one side of the border would affect the other. Of course it will if it affects the numbers on our side of the border. And so any lifting or suppression that is done, again, the coronavirus doesn't know what a border is. It just knows how to spread, and that is through contact, and that is excited or elevated when it's a denser area where there are mass gatherings, but then it continues to spread. And so we will keep track of whether it's Chicago, Illinois, or Danville, Illinois, or Louisville, or Georgetown, wherever this is coming from, and I'm not suggesting that it is, but it will factor in, and that's why we stay in contact with one another. That's why we're tracking how methodical and aggressive we all are. We're also, primarily I should say, it's not just about that, it's not just about opening up, it's also about ideas that they may have in terms of obtaining resources that we may need. I mean, we spent a lot of time today on the phone with the governor of Ohio and Kentucky talking about the scientific project that we announced just yesterday. This is going to start happening around the country. We're just kind of at the front of the line, but it is going to help us inform, as Neer said, yesterday, we're kind of looking at the tip of the iceberg here, but how big is that iceberg totally? And so when we're able to share practices, or we're able to share, here's how much we're testing compared to Ohio, Kentucky, Illinois, Michigan, the rest of the United States, those best practices that, again, Senator Braun talked about, they matter. And so you got to stay in close communication.
Elizabeth Binion, PBS, Michiana.
Good afternoon, Elizabeth.
Good afternoon, Governor. I had a question from several instructors and students in local dental hygiene programs. Due to the COVID-19 pandemic, live patient clinical examinations have been suspended, preventing graduating dentists, dental hygienists, and other oral health professionals from earning the licenses they need to serve their communities. Will you consider joining other governors in suspending or modifying the clinical exam requirement rules to avoid a shortage of oral health care professionals when the COVID-19 pandemic has subsided, especially given that so many health problems are first detected when people are receiving oral care?
I think we've already set a precedent for that here in the state in that we worked with our nursing school and also with our medical school to graduate those individuals early with their degrees so that they could become a part of our workforce, which we felt to be so critical at this time. And we would be very open to working if that need arose, also with our dental and hygiene schools here in the state to make sure that that workforce is available if that's what they as organizations and as educators of these individuals would be looking for.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. No, this is the question you always enjoy getting. I can just tell by the looks on your faces when I see you from the camera. Governor, one for you and one for Senator Braun. This is a bit of a follow-up to Mike's question from WBEZ about Illinois and Michigan, other states opening up, but also extending their stay-at-home orders. Governor Pritzker has decided, hey, if you're a non-essential business, you can still operate as long as you have sort of curbside service, pickup. And in Michigan, they've opened up golf courses. So the question is, as you folks go forward, looking past May 1st, do you see some of those same things happening? Maybe some of the golf courses opening up in Indiana, some of those non-essential businesses opening when they can, as long as they do sort of curbside and delivery. And the question for you, Mike, is so far we spent about at least $3 trillion dealing with COVID-19. The taxpayers aren't an infinite bucket of money. How much more can we spend like this at the federal level to deal with COVID-19?
Mike, you want to take that while it's on your mind, and then I'll follow up on the first part.
So I would say we're very close to, when it comes to the amount of dollars, we're now, because we're not drawing on this from anywhere other than the government credit card, so to speak. So we weren't forecast to be 26 trillion to 27 trillion in debt until about 2023 or 2024. So everything we do going forward has got to keep that in context. And since I've been there, unlike the well-run state government I came from, nobody seems to really care much about it, kind of shrug their shoulders and go on. But I think anytime we do this, and for any other reason, like infrastructure comes into discussion, I believe the federal government defense is the most important thing that we do. I even vote against spending on that if it doesn't have reforms tied to it. Sadly, there are only a handful of us that do that, especially for things that we like. So when it comes to what else we can do, there is not going to be any substitute from here or in the near future into the near term, no substitute for turning back on in a smart way the economy. And I know in my mind that happens state by state in a national sense, and it happens within any state, probably county by county, because I think that every county is different. And that's due to the fact that there is an end to where that next marginal federal dollar just won't have the impact. And then we got to be careful too that we don't get over the tipping point when it comes to the economic damage. And the tough thing about it, as I said earlier, we can't give 1 inch back to the disease, because if we backslide there, then it has a snowball effect into the economy. So when we get back, there'll be, I think, very little done in terms of additional federal dollars other than truly aimed at any errors and omissions and some particularly hard hit sectors. And I mentioned agriculture, but when I brought truckers into it, they're the barometer for the economy in general. And that tells you how it's starting to ripple its way through the entirety of the economy, state by state, and, into the whole national scene. So I think very few dollars will become forthcoming once we get back.
Yeah, and I would just add on, I mean, those same points can be applied to the first part of your question as well. I would just say that Indiana won't be frozen in place because of some other state or region's numbers. We're not forced to act in lockstep with anyone else. Having said that, we are looking at our neighboring counties or neighboring states because of the potential or ongoing spread. And so we'll let the numbers and the data drive our decisions no matter what part of the state. And again, we tend to focus on the urban areas because that's where the numbers are so elevated just because of the sheer numbers. But we're looking at all of our borders. And in addition, I should say, just to use your example, you use golf. I wouldn't have used that one, but you used it. You can do that right now in the state of Indiana. You can't do that in some other states. You're correct. If you can't do it, it's locally. That restriction is a local decision, and I believe and support those local decisions because they're looking at, Senator Braun just said, county by county. They're looking at what their numbers are. And by the way, thank you for doing that because that's going to help slow the spread and flatten the curve for all of us. I do get a little kick out of looking at other states that announce that they're opening up when they're doing things in the future that we've been doing or allowing here for maybe days or weeks. And so when folks talk about opening up their states to retail, as Senator Braun said, his wife has a business there on Main Street in Jasper, and she was able to do some curbside. That's kind of that first step, that progress that's occurred that I referred to. But some states are just getting to that point, or construction here. It may be different in other states. I'm not saying they're wrong. I'm saying they're right because they're looking at their numbers and fully support them. We're looking at our numbers. And if we have to, again, this is a delicate balance of lifting and suppression in terms of what the data is telling you to do so that we don't experience a resurgence, so that we continue to see these positive trends in the areas that we look at every single day that drive our ultimate decisions.
Our final question is from Kayla, Fort Wayne's NBC.
Hello, Kayla. Good afternoon.
Hi, Governor. You've said in the past that Indiana will reopen various business sectors in waves, kind of depending on the numbers and other data. Specifically, can you share what phase salons, barbershops, and other tattoo parlors are in?
Not today, but yes, we will on an ongoing basis. That's the ongoing work that's going to occur between now and May 1st. We're looking globally at all of these various sectors. Everyone will not go all at once if anyone does, and I suspect we will begin to continue to open up in a very responsible, safe way to the extent that we can. And where we can't, we won't. But we're going to continue to look at all those areas that drive those decisions, and that's not just the numbers, but that's the actual outcomes from the actions that we're taking that will continue to keep us on this current path.
Thank you for joining today's briefing. Details regarding Governor Holcomb's next briefing will be sent in a media advisory.